Good afternoon, everyone. Let me begin by expressing our heartfelt condolences, prayers, and sympathies to the families of the victims of the shooting that occurred earlier today at the ICE facility in Dallas. We're also very thankful and appreciative of the first responders who showed up on the scene, raced toward danger, and secured the situation to prevent any further carnage. The level of political violence and ideologically motivated violence across the spectrum is far too high in the United States of America right now. We need leadership that brings people together, not national leadership that tears people apart. We are here today in the Capitol, ready to get to work, ready to meet with anyone, anytime, any place, in order to avoid a painful Republican-caused government shutdown. We will partner in a bipartisan way to try to find common ground in order to enact a spending bill that actually meets the needs of the American people. Democrats do not support the partisan Republican spending bill because it continues to gut the health care of the American people. Republicans have launched an all-out assault on the health care of everyday Americans, the largest cut to Medicaid in American history. Millions of people throughout urban America, rural America, small-town America, and the heartland of America, along with black and brown America, losing coverage. The Affordable Care Act is under assault by Republicans who refuse to extend the tax credits, and as a result, at least 20 million Americans are going to experience dramatically increased health care premiums, copays, and deductibles. Medicare will face a $536 billion cut at the end of this year if Congress doesn't act because of the Republican one big ugly bill. All across the country, hospitals, nursing homes, and community-based health clinics are closing, including in rural America, because of the Republican health care crisis. And Republicans have effectively ended medical research in the United States of America, including terminating research for children with cancer. This is an immoral assault on the health care of the American people. And that's why Democrats have drawn a line in the sand. We will work together, sit down, meet, anytime, any place, with anyone, in order to avoid a Republican-caused government shutdown and in order to decisively address the Republican health care crisis that is devastating the people of the United States of America. Questions?
Mr. Leader, at this point, with no talk scheduled, do you just anticipate this to be on a cruise control toward a government shutdown?
Republicans have clearly demonstrated they want to shut the government down. Throughout this process, an intentional decision was made by Republican leadership in the House and the Senate not to have a single conversation with Democrats. They're not even pretending as if they want to find common ground. Donald Trump agrees to our demand on Saturday to hold a meeting in the Oval Office to try to avert a government shutdown. The meeting is set on Monday for later on in the week, and then Donald Trump wakes up Tuesday morning and goes on an unhinged rant and cancels the meeting. Why? Because he doesn't want to discuss the Republican health care crisis, and they've decided to shut the government down. And on top of all of that, Mike Johnson, cancels votes that we were scheduled to have next Tuesday and next Monday in immediate advancement of a possible government shutdown, decides that there's no need for us to be in town. I mean, that's all outrageous, and it points to one thing. Republicans have decided to shut the government down.
What do you think got your breath?
When was the last time that you spoke to Speaker Johnson about the shutdown, Commissioner?
We spoke briefly last week about the logistics around the government funding vote, but had no discussion about substance.
If Republicans were to include an ACA funding extension in the CR, would that be sufficient to win your support?
We have to have a conversation with Republicans in order to work toward decisively resolving the healthcare crisis that they've created. And part of that healthcare crisis relates to the Republican refusal to extend the Affordable Care Act tax credits. America is already too expensive. Electricity bills are skyrocketing, housing costs are skyrocketing, grocery prices are skyrocketing, the Trump tariffs are causing increased expenses to the tune of thousands of dollars per year for everyday Americans. And now we're facing this healthcare crisis caused by Republicans that is going to result in increased healthcare premiums, copays, and deductibles that may cost some Americans thousands of dollars a year in additional costs.
When it comes to the health care, does it need to actually be a provision within a bill, or would it be enough for Johnson and Thune to verbally commit to working with you to extend the ACA tax credit?
I have a very forward-looking, positive, and communicative relationship with Speaker Mike Johnson, but there's no trust that exists between House Democrats and House Republicans at this particular point in time, given the fact that they've consistently tried to undermine bipartisan agreements that they themselves have reached. Any agreement related to protecting the health care of the American people has to be ironclad and in legislation.
If the government were to shut down, what leverage do Democrats have at that point?
Republicans control the House, the Senate, and the presidency. The country has been lectured all year about how Republicans are in charge. If the government shuts down, it will shut down because Donald Trump and Republicans in the House and the Senate have made that decision to intentionally inflict pain on the American people. The question is being asked all across the country. Why don't Republicans want to address this health care crisis that they've caused related to Medicaid, hospitals, nursing homes, community-based health clinics, the Affordable Care Act, medical research, cancer research, Medicare, and the things that matter to the health and well-being of the American people? Like, this is a serious moment. This is not a fire drill. It's a 5-alarm fire that Republicans have caused related to the health care crisis. And that's why Democrats have drawn this line in the sand and are ready, willing, and able to have a conversation with any of them, as we were willing to go to the White House, but then Donald Trump decides to pull the plug.
Mr. Leader,
Go.
can you respond to Leader Thune? I mean, he did say in an interview earlier today he is willing to sit down and negotiate specifically on this issue of the ACA subsidies, willing to have that conversation. He just doesn't, in his words, want the process to be hijacked over government funding. Can you respond to that?
No one is hijacking the process. Republicans decided to put forth a partisan spending bill that barely escaped out of the House and then went down in flames in the Senate. They have no solution. Republicans have no path forward. There is no viable bill. And so the only path forward at this moment is for us to have a bipartisan conversation as to a spending bill that would actually meet the needs of the American people. And we were on track to have that conversation in the White House until Donald Trump and the Republicans backed out. They're running scared. They have no defensible position. And that's why, unfortunately, they're marching us to a government shutdown.
Mr. Leader, what precisely is partisan about the Republican bill?
Democrats did not support the spending agreement in March in the House of Representatives and overwhelmingly in the Senate because it represented, at the time, an attack on veterans, an attack on housing, an attack on nutritional assistance, and an attack on the health care of the American people at the time. That's why the bill did not receive support from House Democrats, with one exception, in March. So the legislation that they've put before the House and now the Senate in a take it or leave it fashion is just a continuation of a dirty spending bill that we did not support in March.
But Mr. Leader, this is a bill that would temporarily fund government. There are not the traditional riders that we see about policy on it. Are you saying it's partisan because Democrats won't support it? Isn't that a circular?
No, it's not partisan
project?
because Democrats won't support it. Democrats did not support it in March. We did not support this bill.
Why is this one that would be temporary funding through the end of November, why is that partisan?
It's partisan because it didn't have the votes in the House in a bipartisan way. There was no conversation, there was no discussion, there was no effort to actually sit down and figure out what type of spending bill would meet the needs of the American people. The notion that we're supposed to accept that this is a clean continuing resolution is a joke. It's not, it's dirty for a wide variety of reasons.
What are those reasons?
I explained it repeatedly, and it continues the assault
But
on the health care of the American people.
Those are the old Biden spending levels, though, the Democrats.
They are not the Biden spending levels. Let's be clear about that. The Biden spending level, that's another Republican talking point. The Biden spending levels were agreed to by President Joe Biden in the December continuing resolution. That's the bipartisan bill in December, not in March. That's the Trump spending level. And the notion that anyone would just accept the statement that those are Biden spending levels, when it's very easy to take a look at the bill in December that was passed with bipartisan margins and signed into law by then President Joe Biden, and the bill in March that was jammed down the throats of the American people in a very partisan way and signed into law by Donald Trump. Don't accept that idea that it's the Biden spending numbers when the facts say exactly the opposite.
Do you and Leader Schumer plan to make another request for a meeting, or are you waiting for them to come to you?
I expect to have a conversation with Leader Schumer at some point later on today. We've been in close contact with each other. We've repeatedly made clear that we are going to work together anytime, any place, and sit down with anyone on the other side of the aisle in order to avoid a Republican-caused government shutdown and to address the Republican health care crisis. The Republicans have refused to meet because they don't want to deal with the health care crisis that they've created. That's the reality. The largest assault on the health care of the American people in history. And no one disputes that. It's an assault on working class Americans. It's an assault on urban America, an assault on rural America, an assault on small town America, an assault on the heartland of America, and an assault on the health care of black and brown Americans all across the country. Those are the facts. That's why we're standing up in defense of the health care of the American people. Our message is simple. Cancel the cuts, lower the costs, save health care. Thank you, everyone. Thank you.
Is there any back channel with the White House at all, Mr. Leader? Thank you.
Yeah. I was going to send it out.